Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.
Paano ba maging bida sa panahon ngayon kung ang kontrabidang dapat talunin ay COVID-19? Ganito ang BIDA Solusyon!
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay. D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
BIDA Solusyon sa COVID-19! Paalala mula sa DOH, PCOO, IATF, NTF at USAID.
Maayong gabi sa atong mga followers and viewers from Cebu, Bohol, Negros Oriental and Siquijor nga nag-follow karon sa Department of Health Central Visayas Facebook page. Maayong gabi and welcome to another episode sa ato ang BIDA Solusyon Virtual Presser. For our episode this week, as usual, we will be asking a spokesperson for updates on the COVID-19 cases dinhi sa Central Visayas. And then later on, ato pong paghahisgutan ang duha ka topics na related to mental health. Mao kini ang Alzheimer's disease and ato ang celebration or observation rather of World Suicide Prevention Day or Suicide Awareness Month, no? So, but before we discuss atong duha ka topics nato, I'd like to introduce first ang ato ang mainstay na sa atong BIDA Solusyon Virtual Presser, ang spokesperson of the Department of Health Central Visayas for COVID-19, Dr. Mary Jean Loreche. Maayong gabi, Dr. Loreche, and welcome once again, Doc, sa BIDA Solusyon Virtual Presser.
Maayong gabi, Miss Rachel, and maayong gabi sa tanan nga ga-follow sa ato ang programa because I believe that everybody will get something from our discussions, no? And so I'm happy to be back and we can discuss Region 7 muna.
Yes, Doc. Region 7, ato i-specify kay si Dr. Loreche, nagsigi na ba o making her way around the Central Visayas regions, no? Kay kini karon ang murag na-expand naman ang pananaw nato dinhi sa Department of Health when it comes to COVID-19 cases. So, sige, Doc. Go ahead, Doc, for COVID-19 updates, Doc, for Region 7.
Okay, for Central Visayas, our total active cases as of yesterday nga report nato is 1,818. So ang atong additional nga bag-ong mga kaso, makita nato there were 31 cases only newly confirmed cases or positive cases. For Cebu City, 6 only, no? And then Lapu-Lapu is 1, Mandaue is 2. Sa province nato, no, meron kita sa Cebu province 21. For Bohol, wala tayo bagong reported new case. For Negros Oriental, we have 1 additional and wala po tayo bagong kaso sa Siquijor. So mo na siya ang ato ang mga and total reported recoveries nato is 16,376. Total reported deaths is 1,166, no? So makita nato nga atong recoveries is very high also. And the new cases that we have apparently is still very low. And we are already on the 8th day of our MGCQ.
That's good to work, kayo, Doc, no? Hopefully, fingers crossed, gihapon nga ma-maintain na gyud ni siya nato, Doc. Especially since the IATF has already announced, Doc, no, nga earlier that ang assessment, no, of the community quarantine will be monthly na, if I'm not mistaken, every 30 days. Okay, Doc, kanino, amukod siguro ni ang challenge na giatubang sa Region 7 nga mapadayon, Doc, ang kining ato ang bubo nga new cases ug taas nga recovery.
Correct. So, tanawon na pa, Miss Rachel, no? We can actually claim we have flattened our curve already.
Okay.
our combined critical care utilization as of yesterday, less than 30%. Naanata sa 28% na lang ato ang critical care utilization. Meaning to say, gagmay na lang ang ato ang mga bagong kaso and gamay na lang ang mga nasa sulod sa ospital. So we really have enough space, enough healthcare workers, enough ventilators and ICU beds. If, for example, God forbids, we have additional cases that will require hospitalization.
Okay. Doc, this time I'd like to repeat the question I asked of you also in the past 2 episodes na to. Testing, Doc, because I think the last time ningong ka nga gamay paghihapon ang mga tao nga gapa-test because of the fear, nagihapoy fear sila, Doc, no? So, is it still the same thing karon, Doc, ang imong nakita nga sitwasyon diri sa Region 7? Gamay pa baghihapon, Doc, ang even if naanay testing available, Doc, do we still have a big number of people nga kinahanglang matest?
We still expect, no? We would really want people to be more aware that they need to be tested. Sa karon, ang atong number of samples nga gasulod sa atong mga laboratorio, dili pud kaayo daghan gyud kaay sa nga tanan. Mao na nga makita nato, whatever samples are collected are brought to the laboratory. So the laboratories are only as good as the samples as they come. So we really still encourage people not to be afraid but to have themselves tested para we will be able to know and implement the necessary measures.
Okay. Doc, before I ask you about the advisories, you mentioned ganiha nga Region 7 sa ang imong ihatag nga updates. Do you have updates, Doc, regarding, because I know na your team, the DOH team nato, as well as atong OPAV, no, the Office of the Presidential Assistant for the Visayas, medyo gasuroy man mo karon, Doc, around the regions, helping out as well as sharing atong best practices in Central Visayas to the other regions din sa Visayas. Can you give us updates lang, ani, Doc?
Yeah, so basically with IATF, no, and with General Mel Feliciano, together with sa team ni Secretary Mike Dino and the Department of Health, we have been going around. So we've been to Western Visayas, of course, because we really want to share with them our best practices, and we are very happy na we will be able to share that to them. So we know already, I think it was already announced that Bacolod is actually from GCQ placed to MECQ, sorry, because apparently their cases are also increasing, and based on our analysis also, ang ilahang bed allocation dili pa kaayo taas yun to be able to compensate for the increase in the number of cases. But then again, we are very upbeat na with the help that we are giving to them, with the guidance under General Mel Feliciano, I believe na they will learn from us, and hopefully when they implement that with their EOCs that are being in place also, we will be able to help them curb the tide, no, or the surge in their cases.
So, Doc, kanino, it feels good after months of sa una kita ang nasa hotspot. Now, Central Visayas is in the position to help the other atong neighboring regions na to in the fight against COVID-19. So, Doc, do you have other advisories, Doc, from DOH you'd like to share with us today?
Yeah, so again, Ms. Rach, no, we are reminding everybody our advisories will purely focus on everybody's participation, discipline, and cooperation with us, so we'll be able to maintain what we have right now, no? Kay remember nga, even if the vaccines will be already out, and by the way, it will soon be out for the clinical trials, no? Kasi our very own Vicente Soto is actually one of the 5 hospitals that is going to be assigned to be participating in the clinical trials for the vaccines, no? So medyo matagal-tagal pa itong ating laban, because eventually, even with the clinical trials for the vaccines will be implemented, we still have to wait for some time to be able to assess its efficiency and efficacy, and to make sure na wala siya complications or side effects. So meantime, and even if naana na ang ato ang bakuna, our minimum health standards will be the one that will really help us flatten our curve, continue on helping us to be able to fight off the pandemic.
Yes. Dr. Mary Jean Loreche, thank you so much, Doc. We know you're busy, no? Going around Visayas, Doc, dili lang kay going around the region, going around Visayas, doing your share, Doc, in the fight against COVID-19. And hopefully, Doc, no, we will also be hearing good news from you soon regarding also ato ang sitwasyon din sa Region 6 ug sa Region 8. So, Doc, I'd
Yes.
like to ask for your closing statement na lang, Doc. Unsa may ato ang mga, aside sa nahangyo na nimo ganiha, siguro napakailaing i-reiterate, Doc, to wrap up ato ang updates na nahatag nimo. Go ahead, Doc.
Yes, under the leadership of RD Jaime Bernadas, no, I believe that the Department of Health in Region 7 is really equipped with the guidance, no, and the clear directions on our fight against COVID. So us here in Region 7, being able to transfer knowledge also and share our best practices to the others who are willing to adapt our practices, I think that speaks volumes of us, no? So we want to thank everyone for always being with us, especially the media, Miss Rach, no? Kayo talaga ang aming partners for this. Maraming salamat po.
Daghang salamat as kang Dr. Mary Jean Loreche, ang ato ang spokesperson for COVID-19 from the Department of Health Region 7, sa iyahang mga updates, no, nga gihatag karon dinhi sa atong programa kung kamusta na ang atong COVID-19 cases dinhi sa Central Visayas unya. Karon, moving on to the next topic nato for our episode today, I'd like to introduce ang ato ang ikaduhang resource person nga muhisgot, no, mutuki kabahin aning ato ang Alzheimer's Disease Awareness Week. So kini siya usa ka selebrasyon nga giset sa Department of Health ug sa Philippine government to raise awareness about Alzheimer's disease. Unya, I'm sure, no, daghan na nato ang familiar aning Alzheimer's disease, pero wa lang gyud ta totally nakasabot ug unsa ni siya. Mao kini nga niya nga to ang bisita for our program today, ang ato ang neurologist from the Visayas Community Medical Center, Dr. William Boot. Maayong gabi, Dr. William Boot, and welcome sa ato ang BIDA Solusyon Virtual Presser, Doc.
Good evening. Thank you, Rochelle.
Yes, Doc. Oo. Salamat, Doc, no, for joining us sa ato ang programa karong gabi. Unya, Doc, siguro I'd like to ask first regarding aning Alzheimer's disease, Doc, no? Naabatay cases, Doc, naabatay statistics kung pila nagkadaghan ba, Doc, ang mga Filipinos who are suffering from Alzheimer's disease?
Actually, sir, nasa ko atubangan na slides. Pero di ko kanundog kung sa tuning tuligan ito. I think this was last year na. Sumala pa diri sa ato ang statistics, ang dementia prevalence is about 10 or 11%. Age 65, no? And then, in a common ana, you actually have an increase by about 5%, or it doubles the number every 5 years. So that by 70%, you would already have about 21%. And then by the time you're 75 years old, so that would double again, and double again, and double again, no? So much so that by the time you're about 85 years old, majority of us who are elderly will have some manifestations of dementia. Kaya pagkatapos ang imong ipangutana about sa population, lalaki will have about 82%.
82%.
Of the people have dementia, and then 70.4% are women. Okay, and the reason is because but before I go to that, we have to clarify kung unsa ng dementia, unsa ng Alzheimer's.
Yes, Doc.
Okay.
Yes, Doc. Oo.
Ang dementia is mura pag-ibutan mo ang term, general term. So So, specific na sakit ng epilepsy. So, ang Alzheimer's is only one of the branded disease of Alzheimer's. No? Yes. And Alzheimer's is about 85%, no? Of those. And then 11% are vascular. And then about 3% are other dementia. So, ano sa may gusto ito sa na? Ang kanang Alzheimer's is usually more genetic, and there are other factors which are going to precipitate or if not worsen the condition. Okay, so for example, butang na to kanang pareha karon ang COVID, kahit tungod na pundo naman sa balay, wala stimulation ang utok, kaya sige tanaw TV puro sa gihap nga ng COVID diseases statistics. And then, wala pag-contact sa ilang mga anak, ilang mga apo, ilang kailang, miga, unless of course, parehan mag-Zoom or mag-Messenger. But even then, because there is hardly any personal interaction, what happens is that dili kasi natantan to ma-stimulate ang ilang pagdaon na ilang butok. Mga negosyo are also down, and etc. etc. So nothing stimulating as far as they're concerned. So mo na one of the specific factors na mahimo na itong point out, especially in relation to our situation right now. Now, the other disease conditions are cardiovascular, is because of either a disease in the heart or in the peripheral blood system. So, ang nanginabot na katulad kining tanan are all a summation of the following factors. Diabeteson ka, taas imong blood sugar, taas imong cholesterol, stressful ang imong situation, manigrilyo ka, mainom ka, plus etc. etc. So all of those are going to affect, of course, the heart and the blood vessels. Kaya apektado man ang heart and blood vessel, then ultimately maapektahan ka ito. Ang mahirap po na is that ang kasing ang blood vessel mo naitaya, quote-unquote, kanya pagkatapos mulagpot ang katong kaya pagdating sa utok. And then, bisa kinag may pintik-pintik lang kung mini-stroke sa imong utok. What happens is, the summation of it all will be, the whole brain will be affected. And so the system is also going to be affected. So that is the reason why ang mga lalaki has a higher incidence of dementia, because they are the ones who usually are more abusive. Sila ay manigarilyo, sila ay mag-inom, sila ay under stress, although pare-pareho na siguro diabetes o hypercholesterolemia. Pero in other words, mas ang lalaki ay makakapektuhan.
Higher ang risk.
Yes, for males. Kunya, pagkatapos, na ibang mga sakit, for example, na mga infection, labihan pa sa karon, under stress gihapon, na mga katanon, why do we see younger people in particular? Because, number one, they either use drugs. Okay? So, ang katong drugs na to, whether cocaine or shabu or anything else, which usually causes damage to the brain, kaya ano man, makalit magsaka ang blood pressure, or makalit o pangusog ang imong kasing. So if there's anything abnormal na daan ito, magpapad to, katong mga taya to the brain. And so that's the reason why we're seeing younger people who would have dementia. Okay, so that is also part and parcel of the situation around. Okay, so more or less, trending. We don't. This is sorry, one shot na kani ako na quote ni mga na figures. Wala sila mo report over a period of time. So this was just a picture at the particular time. No? Yes. So mo nang dili ta kayo mga trending ni grabe ba. Pero I would have an expectation that it might be because of the COVID.
The pandemic. Okay. Doc, you mentioned You mentioned, Doc, no, medyo, I'll pick up on what you said nga.
Okay.
We're seeing younger people now nga nagpakita ani nga mga signs, no, of dementia, Doc. Doc,
Yeah.
meaning to say, kay ang, nahibaw, ako ang, like, ako, Doc, my association, akong knowledge na akong nahibawan kabahig Alzheimer's disease, it only strikes kaning mga tiguang, Doc, no? Like, you mentioned nga, age 65, no? Ang na-mention mo ganiha, Doc, ang age 65 dinhi sa Philippines nga naanay 10 to 11% nga kaning cases. Oo. So, Doc, meaning to say, even if you're younger than 65 or ano, pwede na di ay, Doc? Maka-exhibit na kag-dementia, Doc?
Yes. As a matter of fact, we're seeing people like they're already in their 40s, only in their 40s.
40s?
Yeah, we're already starting to see it. Mostly because of, I will read to you what are the common treatable causes of dementia, okay? Chronic drug abuse, okay? Sige kag-injection. Kada injection mo na ay maapil na hugaw, na ay katong mga whatever, latak, no? Pagkatapos sometimes na hangin nga masud, etc. And the drug itself can cause brain damage. Another one is chronic subdural hematoma. For example, butang na nato kaning boxing, or for the young people kaning contact sports, no? For example, football. Kaya pagkatapos ka ng headbutts, no, kanang on ang bola sa ilang ulo, or kanang yung sumayon yung nila kung kinsa to ilang kontra, or sa boxing pagkatapos sa sumbagan ng ulo, and then obitaw ng uban na boxers nato mga matay ang quality. As a matter of fact, there was one that submitted for physical examination for me, kind of a neurological examinations, and then I found out that he had significant brain damage. And do you know how old he would be? He would be somewhere like about 37 or 38 years old. Boxer. Another one is normal pressure hydrocephalus. Tapos another one is brain tumors. Kaya naapoy ba na ito katong vitamin deficiency?
Yes.
Hypothyroidism, vitamin B, na ay syphilis, although it's not that common here in the Philippines, but we do have those. No? So those are the more common causes for dementia in the young.
Among the young. Doc, what if, Doc, very curious lang yun yung question. Kana mo ingon nga, limtanon, siging malimot, Doc. Is that a sign already of dementia? Kaya, murag mingon nga, ay stress kay ko karon malimot ko. Forgetfulness, is that when can you say, Doc, nga kana limtanon lang o kini dementia na?
Makalimot ka na gali sa pangan sa imong bana or sa imong asawa. Grabe na yun.
Kurang dito yun na siguro lang, Doc.
Ano pa na bungol ba? Kung di kayo katulog siya sa asawa, normal pa na. Anyway, most of the times, forgetfulness per se is not dementia. Okay. Most of the times, because we're very busy, we have multitasking, okay? So, katuyok ka, pagkatapos nagbutang to ng mga gawin etc., nakalimot ka na, ball pen mo, etc. So, how best do you plan? It's not something for me to worry about, but it is something for me to cope. Not so, for example, kung the usual, kung nakita pa in person, makita mo nga naagapitay sa ako at tanan. For example, kung ako ang tuyos na agapitay. Okay? Ang gawin na ako, nakakadena, kung kita ka na kadena. Ako lang asawa mo, iwa makakadena na ako. Okay? Kaya ambot na sugot na makalimutan. Pero anyway, but otherwise, because of our business, we tend to forget things. So
we tend to forget.
Mindfulness. Now, when do we say that it is really abnormal? Like for example, dili ka nakadumdum sa pag-dial o telephones. No? So, for example, 2530157.
Oh.
So, sa'yo naman mo. So, 7 digits, very easy. You can remember it for maybe a few minutes, 1 minute, and then you can still recall it. Pero I give you the number now, and then I ask you to redial it immediately. Mag-lisod ka na. So, one of the tests that we usually ask is to ask them to repeat the number, the 7-digit number, and then they can repeat it immediately after. That's fine. Pagkatapos, however, if I'm going to ask you, Rachel, palibra ko mention factory ha, pero baliha ang sequence ha. 5179, baliha. Tubad, kaya
5179.
baliha na mo.
Doc?
I-reverse niyo mo.
9715. Nag-exam na mi.
Layo ka pa. Okay, so
exam on air.
Yes. And then another one is we ask you to balance the checkbook. Hindi na sila kasubay na maglisod na sila. Okay, so those are the ones because there's already the beginning of katong memory nga significant na makalimutan sila sa pangalan sa ilahang anak na dili na makita. Mas they can remember kanang naarigid sa ilang tupad. Mora na sila. Okay.
So it's good to know, Doc, no, nga naay actually there's a measuring stick na adaytay yardstick nga magamit na mag-gauge na to, Doc, no, kay murag casual kaayo. Naaday exam. Naay test. So because I think it's commonly casual ra kay kausahay ang expression nga nagsugod na kag Alzheimer's kay malimtanon, but it's also, I guess, Doc, no, education is very important sa kini nga for this disease para masabtan kay sama sa ibong giingon nga the increase in the numbers, it doubles every 5 years, no, ang cases nato. Pero Doc, I'd like to ask, is Alzheimer's disease makonsider ba ni nato nga a deadly disease, Doc? Makamatay ba ni siya?
Dili ka mamatay ka lang sa kapobre kay magurot na yung kwarta sa kambal pagbayad sa imong doktor. Okay? Okay, most of the times this will last for like 10, 15, 20 years. And they die of other things other than Alzheimer's itself. Yeah, so it's not deadly.
Okay.
Yeah, it's not an acutely deadly disease.
I see. Pero Doc, once naanay Alzheimer's disease, no, ang isa ka tao, is there a way, Doc, nga, I don't know, naanabay naabatay tambal ani karon, Doc, sa Alzheimer's disease? Unya naabay mga tips on how to kanang stop, prevent, or slow down ang pag-progress sa sakit?
Okay. First, siguro ato sa itong kanang to katong preventatives, no? This is actually suggested by DOH only, although it's not necessarily what I would be doing. But first, we have to differentiate between Alzheimer's again and other reversible dementias. No? What we do is we make sure that we do not have a reversible dementia. If reversible, for example, vitamins lang, then we give the vitamins. If it's thyroidism, then we give. If it is an infection, then if it's a drug use, then we stop. For others, we take care of the vascular problems. So that's what we do, okay? On the other hand, if it's Alzheimer's, then we will have specific medications for it. In general, todos las santos na lang, mao ni ang gikuan sa WHO, no? Aim to maintain systolic blood pressure of 130 millimeters mercury or less in midlife from age 40 years old. So in other words, i-control na ito ang blood pressure. So that's the reason ako personally, mas aggressive ko sa ako ang pag-handle of BP. Okay? Ikaduha is, of course, the use of hearing aids for hearing loss. Okay? Protecting ears from high noise levels. Kay Ilabihan pa, kaning mga batanon, nga sige kuminaw ang cellphone, full blast, may music na rap or whatever.
Yes.
Mo nang mga bumol na sila. And then, remember, you have several senses which connects you to the outside. The foremost of which is the eye, and the second is the ear. The eye we usually take care of, kaya hadlok mata, mabuta. Pero kanang bumol, wala problema. For many people, and they do not take care of it. So that's why it's important, okay? So the third is reduce exposure to air pollution and secondhand tobacco smoke. No? Ang uban mo na direct smoking. Actually, besides ang secondhand tobacco smoke is actually also damaging, not only to your brain, but also to your brain. No? Because the effect of the nicotine is actually to reduce the caliber of the blood vessel. That's why it reduces the blood flow into the brain or to your heart or to whichever, So mo na ato na minimize. Another one is prevent head injury, particularly targeting high-risk occupation. So for example, katong boxing, katong mga whatever, kung kinsay matay o gamuto, whether you're a professional football player, whatever, mga sports, contact sports, okay? Kunya, pagkatapos, or kanang pagsulog o helmet, kanang mag-bike, Kunya, pagkatapos, ang uban dili mag-helmet. Marang bisag bata, bisag gamay pa, it's very important na batangan natin ang helmet, okay, to prevent that. And then, prevent alcohol misuse and limit drinking, to less than 21 units per week. So, in other words, basta, i-reduce na mo ang drinking. In other words, if it is possible, why drink? Some people will make excuses, pero if you're going to be exposing yourself, nabihan pa on the background that your family has Alzheimer's, then you better be aware, nakatanay genes for Alzheimer's, mo pa rin ipakapinan ni ubang mga factors.
Sa imong lifestyle.
Okay, yes. So, stop smoking, support individuals to stop smoking. Kunya, pagkatapos, minimize stress at any age. Kunya, pagkatapos, provide all children, education ay mag-isulti. Kaya nga naman, the higher your education, the lesser ang imuhang Alzheimer's risk or dementia risk. Kaya nga naman, the more of your brain that is going to be utilized, okay, and connected, and interconnected, the better will be its survival. Okay, if it is going to be put to stress, kung naman ako yung mga matay, na may mas dakang nahibilin. So that's the reason why, okay? And then, pagkatapos lead an active life into midlife and possibly later life. That's the reason why, ang ako yung suggestion is, duwang ka na, bahala nagsukot ka ni kinsay mo ni kasukan, paminaw kay haron mag-rigor na imong utok o imong kasing-kasing, haron ma-stimulate, and then you can stand up, sumbagon ba ng ang TV ba nimo or whatever, or hangin ba lang, basta do it, and then sit down, stand up, go walk around, go upstairs, etc.
Yes.
Ang final ibutan dali is reduce obesity and diabetes. Mga na ito ang mga sakit karon. Kaya gi-lockdown ta pero i-lock up ang refrigerator.
Tinood na, Doc. Maka-attest ko, Doc. Dr. William Bot, Doc, thank you so much for sharing all the katong tips. Siguro, Doc, before, since we will have our next topic in a little while, to wrap up ato ang discussion, Doc, about Alzheimer's disease awareness, I'd like to ask you, Doc, unsa may imong hangyo sa publiko, especially sama sa imong giingon na anay pandemic. Everyone is forced to stay indoors, kauban ang atong mga household members, family members nato. In your closing remarks, Doc, may I invite you also to give your message to the Filipinos, Doc, nga kanang atong ang Cebuanos especially nga naminaw karon kung naa sila'y kauban dok sa balay no nga naaani nga sakit ang Alzheimer's disease or naabay dementia, other dementia related nga mga sakit dok, how can they support their loved one? And then for the entire sa general public, unsa man ang mabuhat sab nila dok aron makatabang sila sa pagpasabot, no, awareness, increased awareness about dementia. Go ahead, Dr. William Boot.
Yes. Hangyo lang ko ni mo na shell nga mas taas tayo. Ako the biggest that I will have to.
Yes, Doc. Okay, Doc. Yes.
Especially relatives is this, no?
Yes.
First and foremost, mag-anticipate na gud mo nga naagay maabot ng panahon nga inyong mga katigulangan mo develop yung dementia. It's becoming more and more kanato gayon lang nato ano lang pero karon mas klaro na para nato. And because of that, number one, please consider consulting a professional, okay, who will be able to explain the whole thing to you in terms of medications, in terms of the progression, and especially in terms of the progression kung unsay mitigating how to minimize the effects of the disease. Okay? Pero those are all something that we can learn. The biggest problem which I usually see is when mapuno na ang mga kabantay, and then what happens is that they start abusing the elderly. So many times, ang anak nagitialan sa ATM, sa sunuglanan, hindi ko pa sa kwarta, later on magkaminos, until finally wala na kwarta. As a matter of fact, there was one that I know na parent, ibiyaan yun ito sa gawas, kaya nanabaho man sila, hadlok man sila, at tingali niya, masunog niya ang balay, so ipadlock ang balay, magpuat yung taon ang katong pasyente, nagpilamak na ito sa gawas, galing usahay, tapang ko ba lang kapasilungan, mawanan, mainitan, etc. And that is a crime. That is what is. Mo na ipukat sa ako ang bukan, kaya nga naman, doon naman ko na. So, and then, pagkatapos, one thing which I can suggest is that pagsabot yung mga pamilya. Nga, kung gusto manggali, sa sunugdanan, baka sa tayo yung desire to help, unit mo, kana ay gamay pa man ang inyong mga palaro, no? Pero 3 years into the treatment, mahal gaya ko ng panambal, kaya manili ko, nung manggalit mo tambal, balik naman ang sakit. So, ito kung tulog ka po nagsuon, ang katong kinamaguangan, anak na ito nag-high school, o di ba nag-college na, so dahil doon, muna na po support doon. So, kato na lang ang kataliwa o katong kinamanghuran. At finally, katong ikaduha mo, nung nasad, huwag ang kinamanghuran nga mo, ibilin mo na ito yung mga hinabo, na pagkataho na ang tiguan, kaugo na, ikaw na. Remember, these are the people who took care of you. Fed you, fund you, di mo patungtungan o lamo o langaw, dili matug, kaya mo makatug, etc. Mo na pa-eskwela na yun. So, those are the other things. Otherwise, ang katukupan, you can just, pwede naman mo tanaw YouTube. Ayan na lang mo, tawag na ako. Tawag mo ang Dr. Google. Kaya, maglintang nun na ba ko, dili niya ako kasingil niya ninyo.
Ikaw, give up.
Okay.
Okay. Doc, thank you, Doc, no? Those were really useful kayo, Doc, and eye-opener sab, Doc, no? Ang imuhang nahatag sa amo karon nga information, especially for those who are taking care of a loved one nga naa-naaning sakit, no, sa Alzheimer's disease unya in the middle pag yun of a pandemic. Sama sa giingon ni Dr. William Boot, no, nga kinahanglan gyud ang understanding ani karong panahon na unya mas maayo man kuning aware ta ani nga mga sitwasyon aron malikayan sab nato, no, nga mabutang ato ang mga kauban sa pamilya, nga mabutang sa alanganin. Sumayo ni nga especially for the young ones, no, ang mga younger ones karon nga medyo wala na kaayo nakaatubang og mga mentally stimulating nga mga activities. So kanino, this is a very good reminder for the younger generation na you keep yourself mentally stimulated as well on top of all the other katong gihatag na tips ni Dr. Booth to prevent nga kita maka-develop pud ta ani nga Alzheimer's disease. So daghang salamat sa atong neurologist of the Visayas Community Medical Center, Dr. William Boot. Thank you kaayo, Doc, and salamat, Doc, for joining ato ang BIDA Solusyon Virtual Presser karong gabion na nga tips. So karon, moving on to our last topic for our episode karong gabion na, I'd like to introduce first ang atong resource person gikan sa Vicente Soto Memorial Medical Center, Medical Officer 4, Dr. Christine Villero. Maayong gabi, Doc, and welcome to the virtual presser of BIDA Solusyon.
Hello, may gabi, ma'am. May gabi sa tanan.
Yes, Doc. And Doc, kining ato ang next topic is closely tied also sa ato ang nahisgutan ganiha nga topic on dementia-related nga mga diseases as well as ang Alzheimer's disease awareness nato nga observation. This time, atong hisgutan, Doc, ang kining World Suicide Prevention Day as well as Suicide Awareness Month na may gi-dedicate nga panahon or kaning adlaw or buwan ba ni nga alang lang awareness about suicide prevention. So siguro, Doc, for my first question, dako ba ni nga problema karon, Doc? Is suicide a big problem? Especially karon, Doc, dinhi sa Philippines, being an Asian country unya, given ato ang kining daghan ang nahitabo karong panahon na, Doc, in the middle of the pandemic. Is this a big issue right now, Doc?
Yes, good evening again, Ma'am Gabi. I think suicide is really a big problem. If we base it on the data, according to the World Health, the data that they have from 2016, suicide was the second leading cause of death among age groups na 15 to 29 years old. Globally, worldwide na siya. And in the Philippines also, we've seen also a rise in the number of cases sa both males and females. If I may check, based on the data, it rose from 4.5 to 5.2 sa males, and then sa females, 1.8 to 2.3. So, however, 2017 onwards, we don't have any data yet. Pero we can see nga based on the news, siguro if we see mga cases, nagkataas gid siya. So, it's really a problem.
Okay. Doc, before I ask you about the lack of data, ako lang sigurong pangutanon una, Doc, 15 to 29 years old, sakto ba to, Doc, ang imong
yes.
ako ang
based on the World Health.
World Health. So, kanang 15, Doc, is quite young, no? Kaning akong mahinumduman anang 15 anyos murag atong ang mga problema of the 15-year-olds in my time, di lang nato hisgutan ang tuig unsa to siya. Pero that time, medyo dealing siguro with peer pressure, school, murag assignments, mao man ako ang mahinumduman nga murag mao'y problema, but lain magud ang sitwasyon, Doc, also for each generation. So, Doc, 15 is quite young, no? Unsa may ani, Doc, is there an explanation about the lowering kaning nagkabata ang edad, Doc, of those who are committing suicide?
I think one of the reasons that I can pinpoint is kanang mga cases of bullying. It can be linked to cases of bullying, either cyberbullying or being bullied at school, So dako siya factor also for these younger cases.
Okay. I think although I'm sure, Doc, bullying has been around, only lang awareness about it has been increased on mas na-aware lang gid ang mga tao ani karong panahon na, especially nga naapoy cyberbullying.
Cyberbullying, yes.
Yes. Regarding atong lack of data, Doc, na-mention mo, I think, 2016 ba ito siya, Doc? Mao ka to ang imong gibasihan. Ako lang ipangutanan siguro, Doc, murag, kay in most of the other kanang social problems no nga nahisgutan na dinhi sa programa with DOH as well as katong sa amoa sa PIA sa Philippine Information Agency, usually mapinpoint manggod sa mga officials o experts na kinahanglan nila ang data para makabuhat sila og mga intervention programs, data-based ang ilahang approach no sa pag-provide of programs o mga projects no. So kini doc sa suicide when it comes to siguro programs in dealing with suicide prevention, unsa ka importante doc nga naunta tay data nga ma-access bitaw doc like pila may edad and the gender, especially doc local nga data kanang dinhi gyud sa ato sa Region 7.
Yes. Yes, ma'am. Very important that we have a data kaning suicide because it will give us a clear picture unsa bagid ang mga kanang age groups, unsa bagid ang methods of suicide. In that way, para ma-strengthen ang mga programs. I know there are existing programs, pero at least ma-strengthen siya. And at the same time, I think one factor would be the underreporting of cases because of the stigma attached to mental health problems, to suicide. So I'm sure that there are cases that are not reported. So usasad na siya na factor, I think.
Doc, when you say underreporting of cases, meaning to say na ay mga suicide cases ba nga nahitabo pero wala siya na recorded as a result of suicide. Murag ang cause of death is not suicide. Mauna imo pasabot, Doc?
Or maybe no usasad no, it's not, we don't see it on media. So murag wala gid tay idea about it, or maybe they're being brought to the hospital too late na. So kana na mga factors, no. I think one of the reasons would be kana lagi the stigma na di ba we don't really talk about kanang suicide or mental health problems.
Yes, kana doc no ako nang ipangutana nimo unya, but ako lang unahon siguro una is unsa man usually common reasons for suicide, doc?
So there are a lot of mga factors no for a person to commit suicide. No? One of those would be mental health problems. An existing mental health problem, for example, depression, can be linked to suicide. No? Especially kung untreated siya, wala siya natambalan, wala nakapa-consult. Mga existing mental health problems. Other factors would be kanang trauma or abuse, no? And then relationship factors in the family, stressors in the family, problems within the family, problems with relationships, and then kaning mga stress, no? Financial stress, problems at school, and then even those with physical problems, or I mean mga physical ailments, kanang mga chronic na mga sakit, no? Some of them may think about wanting to take their own life kay feeling nila they're a burden. So these are some factors that we have to look into as well.
When you were running through those doc no kaning mga factors nga maka-lead to suicide, I was thinking, doc, nga naara ba tay COVID-19 pandemic karon unya some of the causes of the stressors naa sa balay katong na-mention nimo, no? I think a big part of that naa sa balay ang source niya. Walay choice ang tao karon because we're all forced to stay inside our homes kay tungod nga naa may gisagubang nga sakit, no, nga virus nga naa sa gawa. So doc, ako lang siguro ipangutana, do you think nga possibly, doc, nga mutaas pa jud ang ato ang mga incidents, no, of suicide dinhi sa Pilipinas tungod aning especially during the pandemic?
Yeah, there is a possibility, ma'am, no, nga it may increase, especially kay kanang people with pre-existing mental health problems mas mo-worsen ang ilahang condition because of this pandemic, no, because of the restrictions, and then it na ay negative mental health effect kaning being on quarantine, being isolated kana siya. And then one thing you pointed out katong sa family, which is really true, because before, no, kung ang stressor family, We can just go to the mall, we can go outside, but now it's very limited, no? Siguro what I can advise, no, is we have to learn to kanang think that we have control of our emotions. Wala man tayo, we have no control about outside factors. So kung ang stressor parents, magsigig yaw-yaw or mga saba, so we have to siguro be more self-aware, no, and not let outside factors kanang affect us, no. Learn to control our emotions, and then find ways to make kanang cope with it in a positive way, siguro.
Doc, katong imong na-mention, no, later on I'll ask you for more tips siguro, Doc, because I understand nga, aside from the pandemic that we are dealing with, nga katong giingon nimo nga quarantine, kanang maka-cause siya og negative emotions, no, negative thoughts. Aside from that, naapa jud, Doc, ang kanang trabaho, no? Since we are slowly opening up atong economy, so gawas na po sa ilang mga balay kay they need to work, no, to have food, to bring food back home. But before that, I'd like to ask siguro, Doc, to touch more on mental health kay medyo tabu pa magunahangtod karon, Doc, ang kanang opening up, no, imuhang what you're feeling about niya. Sometimes I know nga it would be met with kanang comments like, ay, kulang ra ka sa tulog, no? Or naiuban nga musulti nga, kulang lang na sa simba o sa ampo, no? When they say na I'm having dark thoughts or di ko katulog, kay medyo basig depressed na ko. So when you open up, medyo in the Filipino context, bitaw nato, no? Sa ato ang pananaw, traditional nga mga mindset, maunay itubag, Doc, usually. So I'd like to ask siguro, Doc, since karon daghan naman, actually I think there is already a lot of kanang mga online gani, Doc, no, nga kanang let's talk programs, no, hotlines. So pero siguro, Doc, naalang ang fear of stigma. Like kung ako aware na ko, because I don't think kulang tag awareness karon kay lately, no, daghan na kaayo ang mga webinars, Doc, mga articles. There's already a lot of conversations and discussions being done about mental health awareness. I think lang siguro, Doc, usa ka problema lang is mismo ang natungdan, di gyud siya, wala siya courage, no, to avail of these programs nga na. What can you say about this, Doc? Kaning especially basig na inagtan-aw na to karon, Doc, no, who is going through kanang emotional niya nga mga chaos or turbulence. Grabe kayo ka-descriptive. Pero kana, Doc, no, na siya pinagdadaanan. Pero naani kabalo siya unsay buhaton. Pero kulang lang, Doc, og kanang courage because of the stigma attached to it. Mga yung ko og reaction nimo, Doc.
Yes. Normal gid na siya. I often hear it all the time, no, nga dili ko magpa-consult kay mauwaw ko, what will other people think of me. But I would tell my patients good, and then I would always advocate that there's no shame when you talk about mental health. Because if we can openly talk about hypertension, diabetes, cancer, why can't we not talk about mental health? Depression, anxiety, these are mental health conditions, but these are also mga medical conditions no nga can be treated. So I would always tell them there's no shame in seeking help, especially if it's for your own good. No, one step I would tell them, it's even brave enough for them to go forward and seek help. Dili ba tanan would have the courage to do it. But if there's someone out there who needs help, please do not be ashamed to seek help. If you feel unsafe, if you feel that you need help, reach out good and ask for help, because it's never too late to ask for help. There are people willing to listen. I'm willing to listen. Good. Just reach out.
Yes.
Help is always available.
Later, Doc, I'll ask you, no, for your contact details. Siguro naapoy uban ba, Doc, nga? Okay, I'll be asking you also, Doc, kung naabay mga organizations nga para lang awareness, no, of those who are watching us. Kung kinsa ni ang pwede nilang maduol or numbers to call in case, no, they need someone to talk to. Okay, I think, Doc, sometimes it's easier magud nga ang kaistorya nimo dili nimo kaila, no, katong imong giingon nga ang shame is there, kung especially kung kaila nimo murag hesitant kaayo mo mo istorya. But if it's someone you don't know, murag mas, I do not know, Doc, sa imong experience, is it the same? It's easier to talk to someone you don't really know personally.
Yes, they say that it's easier to talk to someone you don't know because there's no judgment.
Okay. Oo.
Murag na.
Yes.
Itong kailan na, di ba? Murag, sus, ikaw kuha na magod na, pwede na gud na, inom ra ta or tulog ang magid na.
Sakto na,
So,
Doc,
kaya
no?
siya. Wala ko na yung judgment. Basta dili ni mo kaila.
I raised that, okay, mo lagi na, Doc, usa man gud na nga kanang sa ka-preventive factor ba nga nung dili sila mo istorya sa ilang mga kaila kay tungod nga mo din na because there's a judgment, fear of judgment. Karon, Doc, kato imong nahatag ganiha, Doc, is input on kung ako mismo or ika ang nainaminaw nato karon nga who's going through emotional problems siguro or struggles, Doc, no? How about, Doc, for those who are kaning naa sa palibot, family members or friends, how can they tell unsa may dapat makita una siguro unsay symptoms, signs that ma-warning, mga red flags bitaw, Doc, nga kining usa ka amiga or amigo nila or pariente nila, no, or family member is going through a struggle, going through emotional difficulties niya. Murag kinahanglan na sila na ang reach out, no, mo sit down with that person. And ikaduha, what do they need to think of? How do they approach it para ma-encourage ang katong ilahang kauban or kapamilya nga suffering from depression to really be able to speak up, no, or speak out?
One of the things that you need to look out for if there's a change in behavior. For example, your friend, you would notice na mag-isolate siya, would not do the things that he normally does or enjoys doing, no? Would often talk about, mas better pa siguro I'm off dead or may pagmulakaw na lang ko sa layo, di na ko magpakita kay wa na ko'y pulos, makinana.
Yun, okay.
And then, kaning bisag in pina-joke lang gani na, ibili na nako akong mga gamit ni mo kay mulakaw akong layo. That's also parang marag warning sign na siya. And then we have to take it seriously yun. Bisag pina-joke og sulti. Because one of the kanang myth sa suicide is that if I ask it, dili ko mo ask basi mag-suicide hinoon. It's a myth, no? It's not true. Whether you ask it or not, a suicidal person, acutely suicidal, will really commit suicide. Pero once you're able to ask and the person is able to open up and talk about it, it has been proven that it lessens the probability of actually doing it. Kinakapahungaw na. No?
Okay.
Diba even kita, if we have problems and when we're able to talk about it, mo lessen ang burden. It's the same thing. Those who are suicidal don't really want to die. It's just that they are in so much pain. It's a way for escape na nila. But if they're actually able to talk about it and there's someone who listens to them, it's really a big help, yun.
Or how do they approach it, Doc? Like, from example, Doc, kauban nila sa balay, no? They're seeing kato yung gisulti, no? Nga mga warning signs, mga red flags nga dili na communicative, mag-joke na, anang dark thoughts, no? How do they go about approaching it, Doc? Nga para, kay ang uban, magud mingon nga, mahadlok ko, mong giingon, no? Mahadlok ko kay, saan ako pag-istorya nga, para dili siya ma-insulto, ma-offend o niya.
I think it's important to let them know that you're there. Yeah. Let them know that if they need someone to talk to, naaragid ka, that you can always approach. The family member can approach anytime nga naa. No? Check up on them every now and then. Labi na kung mag-inusaan, don't allow them to isolate themselves. No? Encourage them to go out, to eat together, kanang sa balay. Di ba na uban nga, adili ako niya na kumukaon ka nang inana. So make it a point to check on them. Okay, these are, at least kanang makatabang yun to know that naapay concern, naapay nag-atiman ba, or naapay people around him that's concerned about him. So kind of check up on your family member good. And then if you think the person is highly suicidal, please kanang keep all things that you think he might use to hurt himself, no, mga sharps or kanang mga
So ipalayo siya ng mga
ipalayo,
okay.
So kana gyud. Important.
So okay, it's important nga na highlight ni mo Doc no katong nga mga warning signs ba, mga behaviors to watch out for kay ang uban man gud moingon nga kung usually especially kung batan-on bitaw Doc they're going through kanang hormones. Mingon man na Doc no. So I guess if they see that regardless of the age whether guwang or batan-on kay sama sa giingon ni Doc no as young as 15 years old. So if you're seeing katong nagtan-aw na to karon, if you're seeing these behaviors no among someone that you are living with, friends ninyo, then ayun no, you should reach out sama sa giingon ni Doc. Kay unsa man na Doc, usually kung katong mga tao nga natungdan, those who are going through kanang depression, mental health problems, dili gina nila tendency Doc nga mo reach out on their own kanang sila mismo ang mo initiate.
Ang uban magudan, especially if they're depressed, they don't have the energy to do it anymore. They feel tired, no. And another siguro to add on lang ng mga warning signs, there are those who present with irritability. Grabe ka, irritable, dali masuko, and then increased use of alcohol or drugs. Kana these are things also that you need to watch out for kay mga warning signs sa siya.
I see. Pero murag akong na-pick up you Doc no nga katong letting them know that someone cares for them no. Murag importante kaayo nga
giving them hope good.
Challenging lang ron Doc because wala man tay lessen man ang interaction sa with the quarantine nato karon, but unsa may tips nimo Doc especially since limited ang face-to-face engagement. What tips can you give Doc in the middle of the pandemic how to be able to reach out?
Yeah. One of the things that I would always say whenever I give webinars or lectures is even if we're socially isolated or mag-physical distancing, we have to be connected virtually or always, if sa una text lang, make it a point to call. Hear their voice. If we can have access to internet, voice, video calls, Zoom, FaceTime, no? Especially for those nalagyo, family, friends, no? We can still be connected even virtually, even just through communications, diba? Importante to let them know that you're still there, no? Just to hear the voice, dako gid siya na impact, good. So kind of always keep connections good. Keep connected with friends and loved ones.
Siguro in a way Doc no ang makita lang nato nga advantage right now nga bisag naatay pandemic is that technology exists right now. Kay kung imagine nato Doc no sa unang panahon, how do you keep yourself connected with your loved ones kung wala ang technology niya? Forced to stay at home pag yun. So I think sakto to Doc no nga we should take advantage of the technology that is available to us in making sure to reach out. So dili siya rason Doc nga dili nila mapangamusta ang ilang mga loved ones karong panahona. Siguro lang kung unsa ka kusog lang siguro ang signal ang wifi. Doc, for now, I'd like to ask my last two questions, no? And I think I can ask this na lang simultaneously kay medyo related man sila with each other. First of all, unsa may mga organizations, do we have any existing karon Doc na mga programs, maybe sa Vicente Soto? I'm not sure if you have, but unsa mga organizations na to karon Doc that are offering, no, kaning mga programs or helplines nga pwedeng matawagan, makontak sa katong mga nagkinahanglan o maistoryahan nila no sa ilahang what they're going through. And how about for local government units Doc, because right now I think with the pandemic and with the community quarantines in place, murag LGU siguro Doc ang mas naay opportunity and resources to be able to reach out to the communities, no? Because ang uban nga mga organizations or NGOs that might be working for mental health, di pa man pwedeng makasuroy-suroy. So for that, Doc, I'd like to ask your inputs una, ang katong unsay mga available na resources right now na abatay hotlines or helplines that they can contact, and maybe imuha na lang pong contact details, Doc, if you can share with us. And ikaduha, how can Doc, no, mga LGUs na to, local governments, help in the campaign for, again, raising awareness about mental health? Go ahead, Doc.
Yes, ma'am. Thank you. For the programs in Soto, no, we have our page, the Center for Behavioral Sciences page, and we also have the teleconsult page. So we are offering online telephone consultations to our patients, for their prescriptions as well as for new patients. And then we also have the Tawag Paglaom na it has been present for a long time, ang Tawag Paglaom na anagig na siya daan. And then unfortunately I can't memorize the numbers. Yeah, but I think they also have a page on Facebook. And then we have also, I think, the PMHA, the Philippine Mental Health Association, also offers mental health consults. And so far, these are the, and then NGOs, we have, I think, Lingap Diwa. There, if you see on Facebook, there are mga kind of posts offering free online consults, and then they can just search for it here in Cebu. For the LGUs, so for now, siguro what I hope that they have the means to help their kind of mga constituents. Okay, especially in my experience here in Soto, there are patients coming in na wala din sila access to internet or to online consults. What if the LGUs can provide that for their constituents na whenever they have kanang a patient that needing online consult, tapos wala yung mga Wi-Fi, wala yung cellphone, wala yung internet, that the LGUs can provide that for that patient, for that family, that they will have access lang yun to mental health. Kaya dili man sila, they cannot, especially now that we are only doing online consults, telephone consults. So that would be a big help, good, to have mental health care accessible even in their level, barangay level. Dako gid na siya natabang.
So, Doc, murag katuos sa to kagap, no, nga nakita nato karon for now, ang lack, ang accessibility, especially dako og role ang technology in making sure nga ma-access sa atong mga communities katong inyong giingon nga mga online nato nga mga services for mental health. So, Doc, ato ang pasalamatan. First of all, we'd like to thank you, Dr. Christine Villero, Medical Officer for Vicente Soto Memorial Medical Center, for sharing with us ang iyahang mga inputs as well as insights about mental health niya. Dili gyud siya angay mahimong tabu. Hopefully, the time will come na we are all free whenever we want to talk to someone we know about what we're going through. If we think we're going through anxiety, depression, kung sa inyong tanaw na amo atong mga gimension ni Dr. Villero nga mga red flags, mga warning signs. So, ang iyahang tip, reach out, seek help. Even if someone to talk to lang, be it a friend or someone you don't know, sa katong giingon ni Dr. Villero nga online teleconsult, check out their Facebook pages, kay naaning mga hotlines nga pwede ninyong tawagan. And for those who are nakabantay nga naani among their friends and family members, if you see those katong mga red flags na mentioned ni Dr. Villero among people you know and you love, then there's nothing wrong with making them feel that they are cared for, that someone is concerned about their welfare. So it's still reaching out and seeking their time, nga mag-istorya. Kay mo na usually gyud ang tagline karon sa mental health nato nga mga hotline projects, let's talk all starts with talking about how we feel to someone nga makasabot nato sa ato ang what we're going through. So for those who are watching us, hinaot unta nga tanan ninyong napupo karon ng mga information from our resource persons, no, gikan sa paghatag og COVID-19 nga mga updates dinhi sa Region 7 gikan sa Department of Health, and about Alzheimer's disease and dementia related nga mga sakit gikan sa atong neurologist from Visayas Community Medical Center. And lastly, still related sa unang topic nato, ang kabahin aning suicide awareness, no, and also awareness about mental health. Please share it with your friends and your family members kay it might save lives, no, ang kining being able to share the information, because it all starts with awareness before we can understand and hopefully making a decision later on. So sa nagtanaw sab nato, thank you for joining us in this week's BIDA Solusyon Virtual Presser. Unya, bisag good news na itong nahatag ni Dr. Loreche sa ato regarding COVID-19 na itong mga kaso dinhi sa Region 7, it is still not a reason, no, nga magpabaya ta, magsalig na ta, kay naagi hapon ang COVID-19 wa pa nawala. Taas-taas pa ang panahon before a vaccine can be safely administered to the public. So while waiting for that, please make sure sundo nato ang BIDA Solusyon kontra VIDA. So please, kung nga pa nyo na buhat ni, follow the Facebook page of BIDA Solusyon. Naa dito ang tanan nga mga tips, no, o mga information nga kinahanglan natong kanunay natong mahinumduman every day, as we are still under a new normal and a public health emergency. Kini si Rachel Nesha, gikan sa Philippine Information Agency, and we hope to see you once again next week. Unya, for everyone, please stay safe. Daghang salamat.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.